Hello viewers, today in this video I will describe Michel Foucault on anti-psychiatry. What was Michel Foucault's view on anti-psychiatry? To understand this, first of all, we should know what is psychiatry. Psychiatry is a medical discipline, focuses on identifying, averting and providing remedies for detrimental mental disorder. This encompasses a wide range of issues concerning mood, behavior, cognition, and perceptions. After psychiatry, now we should know what is anti-psychiatry. Cooper coined the term anti-psychiatry in 1967 and he wrote the book Psychiatry and Anti-psychiatry, published in 1971. Anti-psychiatry is a movement based on the view that psychiatric treatment is more often damaging than helpful to the patients. Anti-psychiatry is an approach to the remediation of psychotic symptoms. It considers psychiatry a coercive instrument of oppression due to an unequal power relationship between doctor and patient and a high subjective diagnostic process. The cue then involved a process of opposition, of struggle and domination of the patient's troubled will by the healthy will of the physician. The belief was that the confrontation would not only expose the illness by challenging it, but also result in the triumph of relational determination and the rejection of the disruptive desires. Now, what does Foucault says on anti-psychiatry? Foucault expressed a keen interest in anti-psychiatry, dedicating numerous articles and lectures to the topic and engaging in conversations with different figures associated with the movement. However, when considering his written works, it becomes challenging to classify Foucault solely as an anti-psychiatrist. In his book, Madness and Civilization, published in 1961, in this book, Michel Foucault says that there was a shift in the perception of madness, whereby it came to be seen as less about delusion, that is, disrupted judgment about the truth, than about a disorder of regular normal behavior or will. The way madness was perceived underwent a change, shifting the focus from delusion, it means shifting the distorted judgment of reality, to a disorder affecting regular everyday behavior and violation. According to Foucault, in the past, doctors frequently recommended activities such as travel, rest, walking, retirement, and connecting with nature as a way to escape the artificialities of society and search truth, which was believed to be visible in nature. However, Foucault argued that the dominant therapeutic approach shifted to confronting patients with a strong sense of willpower and conforming to socially accepted emotions, which were ideally exemplified by the physician. In Madness and Civilization, Foucault included anti-psychiatry because Foucault is said to have viewed the Enlightenment as oppressive. Actually, Foucault was neither for or against the Enlightenment. Paulus says Foucault was ignorant of anti-psychiatry at the time of writing History of Madness. Foucault is engaged in an anti-psychiatric endeavor using counter-enlightenment discourse. Instead, Foucault accepted the validity of the anthropological project of the late 18th century with its descriptive diagnostic approach to madness. Psychiatry went wrong when it adopted a positivist approach in the mid-19th century, reducing mental illness to merely a brain disease. Foucault says, to address this, we should employ a disruptive methodology that disrupts the pattern by utilizing the pattern itself. Some patients require complete control over their behavior, restraining their outbursts and humbling their arrogance, while others need stimulation and support to thrive. Foucault also argued that the increasing confinement of the mentally ill had become necessary not just for diagnosis and classification, but because an enclosed place became a requirement for a treatment that was now understood as primarily the contest of wills, a question of submission and victory. Thank you.